for being here. Could you introduce yourself?
Sure. My name is Anil McGee. I'm an interventional pulmonologist. I'm a lung doctor. I specialize in lung procedures. I work at St. Francis Hospital in Hartford, Connecticut.
Great. Next, could you walk us through your journey to becoming a doctor? So where have you been throughout your academic and personal career?
Sure. I was born and raised in Connecticut. So from high school, I was at Kingswood, Oxford, and West Hartford. Then for college, I went to Haverford College, which is a small liberal arts school outside Philadelphia. And there, after college, I was a chemistry major. I didn't really know what I wanted to do. So I took a job, a research job in a microbiology lab, where I was thinking about getting a PhD. However, I shadowed a few physicians and decided to pursue medical school. I got into University of Connecticut for medical school, and during medical school I took 2 additional years to do research. So I spent 6 years doing medical school because I was thinking about, should I do an MD PhD. However, I decided that I wanted to be more clinical. So after medical school, I matched into internal medicine at University of Connecticut. There, I became interested in teaching, and I was selected to be a chief resident in internal medicine. So I spent an additional year after my medical residency becoming a chief medical resident. And then during that time, I did rotations in the ICU as well as in pulmonary, and I fell in love with the types of patients that we took care of in that realm. And therefore I decided to apply for pulmonary critical care. So I did match in pulmonary critical care here at UConn. During that training, I came across to a sub-fellowship called Interventional Pulmonology. And this particular field takes care of patients mainly with lung cancer. It also incorporates minimally invasive procedures in helping patients breathe easier and also come up with a diagnosis of whether they have a lung cancer or not. And I was fortunate to have matched at Mass General in Beth Israel up in Boston for interventional pulmonary. And after that training, my wife, she works at a hospital in Connecticut, and because of family, I decided to come back to Connecticut to pursue my job here at St. Francis.
Great. Could you talk a little bit more about interventional pulmonology, why you chose it, and sort of pitch it to the audience?
Sure. So interventional pulmonology is a relatively new field. It focuses on minimally invasive procedures of the lung. I liken it to what interventional cardiology is. Prior to interventional cardiology, cardiothoracic surgeons would do very invasive procedures to prepare the heart and also to deal with calcified coronary arteries. Now everything's done minimally invasively through vessels in the groin or in the wrist to repair these vessels that are in the heart. In a ways, interventional pulmonology has sort of done the same thing. Thoracic surgeons would do bigger surgeries of the chest, especially when coming to biopsy spots in the lung. Now it's done all minimally invasively while patients are asleep under general anesthesia. And all the biopsies are done through the airway, so there's no cutting of the chest when coming to biopsies. So when I learned about this field, the type of patient population we care for, and also the type of procedures we do, I fell in love with the field. It's very gratifying being able to diagnose somebody with lung cancer and get them to the treatment that they need to rectify it. So if you enjoy sort of fast-paced learning, doing procedures, and also taking care of very sick patients, this is the type of field doctors would be attracted to.
Great. What is something that you'd say you're looking forward to in the field of interventional pulmonology and the next generation?
Yeah, so the technology keeps on changing. So with the addition of AI and also newer techniques to treat patients, I do something called robotic bronchoscopy. So it's a relatively new technology to biopsy very small spots in the lung especially in the periphery of the lung. The hopes is if we can biopsy one of these small spots in a high-risk patient, such as a smoker, we can diagnose a lung cancer early and then treat it earlier so patients have better outcomes. I'm currently going to be involved in a clinical trial looking at robotic bronchoscopy, so going out to these spots, proving that it's cancer, but also doing microwave ablation, so killing tumors in the periphery of the lung. This may be an option in the future for patients that are not surgical candidates to treating lung cancer. So the technology keeps on advancing as a nation, as we become more savvy and understand lung cancer more, and also different companies develop more technologies to help patients. So interventional pulmonology utilizes the new technology that's available in helping patients. So I'm very excited for the next 5-10 years of what newer technologies may develop to treat various lung problems.
Great. You piloted the interventional pulmonology program at St. Francis, correct?
Correct.
What did you find to be your biggest challenges in doing that?
Yeah, as a younger physician, I have to convince a lot of other physicians and a lot of the administrators and people who run the hospital it's the right thing to do to start an interventional pulmonology program. Because I use a lot of advanced technologies, hospitals need to commit a lot of money to acquire those technologies to help patients.
Right.
So trying to convince a generation or physicians that don't really know what interventional pulmonary is, because it is relatively new, trying to convince them that it's the right thing to do to get this technology to help patients. So that took a lot of time to figure out what's the best way to do that. But ultimately, when you have success in treating patients and treating them successfully and safely, they learn and they will commit to you because you're showing progress and you're helping patients in the area.
Do you have any specific patient interactions that have really resonated with you or affected your specific abilities with patient care?
A lot of patients, I take care of a lot of patients that have touched me in various ways. There's a procedure that's called bronchoscopic lung volume reduction. So this is a procedure targeted for patients with advanced lung disease called COPD, or chronic obstructive pulmonary disease. So for patients that smoke a lot, they can develop this type of lung disease, and something called emphysema, which is destroyed lung from smoking. So often these patients, as the disease progresses, they become more breathless, they have difficulties with walking, doing daily activities that make them happy. And a procedure that's been borne out within the past 5 to 7 years now is putting one-way valves into the lung, minimally invasively, to close down areas of the lung that have a lot of emphysema.
Right.
The goal is to redirect oxygen to the better parts of the lung. So this new procedure has shown a lot of success over the past 5 years, and it can treat patients and it can help patients tremendously. So we started this bronchoscopic lung volume program at St. Francis about 1.5 years ago, and we've taken care of about 20 to 25 patients, and these patients have had remarkable recoveries after this type of procedure. You have to be very selective when you try to pick these patients because there is risk associated with it, but the patients that you do it and they have benefit, the benefit's tremendous. So I've had stories where they couldn't walk even 10 feet, but now they're walking through the airport. Or they couldn't even interact with their grandchildren because bending down was such a difficulty for them, but now they can spend a weekend with their grandchild, which is quite tremendous. So those type of stories sort of keep me going and wanting me to do more and learn more to help these type of patients.
And how does it feel completing the first ever bronchoscopic lung volume reduction at St. Francis, being that 1 year ago, and how important are such breakthroughs to you?
Not so much for me. I think it's great for the hospital that we can offer the Connecticut population, the greater Hartford population, for patients that have severe COPD and emphysema, this type of procedure. So it's very satisfying as a group here that we're providing this type of procedure, because patients deserve the best outcomes and sort of the best technologies that are out there that can help them. So if we're one of those hospitals, I'm very proud of that. I think as a hospital system, we're very proud that we can offer this type of procedure.
Being a physician can be a highly mentally taxing profession. How has stress looked like for you, and what do you do to process that?
Yeah, medicine is very stressful because you're taking care of a lot of patients with many medical problems, and it's time consuming. A lot of sleepless days because you're thinking about things that you may do or you have to study. For me, is spending time with my family. So when we take vacations, dedicating that time to my family. Also, exercising is important to me. So being able to exercise will give me some mental clarity. So you definitely have to spend some time on yourself when you're in a field that's highly stressful, like being a physician, or really anyone in the healthcare field.
And what personal qualities do you find to be really important when working in healthcare?
I think dedication is the sort of number one. You have to be not only dedicated to yourself and proving yourself that you can do whatever you want to do, and when it comes in terms to healthcare, but you have to be dedicated to your patients, and that's the number one rule that I've been taught and I live by is patients depend on you, and they depend on you because they need help. And if I let my guard down or if I ignore that, I can do wrong to the patient. So always having that sort of that rule in mind that you're dedicated to your patients because your patients deserve the best outcomes. I think that's a quality that I always look at when I'm meeting other healthcare professionals and seeing how well they do.
With that, what's one piece of advice that you give to someone who's a little unsure about a future in medicine?
I think it's always good to get experience in whatever you want to do in life, whether it's medicine, business, pharmaceuticals, teaching, nursing, whatever it may be, is to get experience. So shadowing, I think, is really important, getting a sense of the type of people you may be working with, the interactions that they would have on a daily basis. Because what I do now as an attending or as a real physician or a real doctor, it's much different from what I was doing as a medical student. So seeing sort of the different experiences that that physicians or anybody may have with their real job is truly important. So I think shadowing is really, really important.
What do you see as the biggest challenge in medicine today? And do you have anything that could remedy that, or any ideas?
Yeah, so I think sometimes it's hard for a patient to be seen, to be given a diagnosis, and then having a definitive procedure for that diagnosis. And often that is related to the patient being sent to different types of physicians or expertise, and it creates sort of a pinball effect for the patient. So there's wasted time from when the patient really needs to be seen, diagnosed, and treated. The way we've done it here is to streamline the process. So if we know the patient has a lung nodule that needs a biopsy, they'll see me and I get them into the right pathway to be seen, diagnosed, and treated. I think that's sort of the biggest problem for patients, because you'll always hear the stories like, yeah, I saw a doctor, it took me a month to see somebody else, and then we sort of got lost in the process. So we need to find a way to help streamline whatever it may be for that patient so that they get seen quickly, diagnosed quickly if they need a diagnosis, and treated quickly.
So organization is
correct. Yeah.
And lastly, what's the best part about being a physician?
Really, it's the people that you interact with on an everyday basis. I interact with people who have done this for many, many years, much more than I have, to medical students, and then residents, to fellows that are training, and to other docs just like me starting their own, to working with patients, nurses, respiratory therapists, to radiation technologists, to anybody that really works in the hospital system. You get to work with people of all walks of life, of all backgrounds, and I think that's the most satisfying thing. So I've always been sort of a people person and trying to interact with the people I work with, and medicine really gives you that opportunity to work with a bunch of different talented individuals.
That's all I have for you. Thank you so much.
Of course, thank you.